Some of the worries I had growing up was I wasn't able to participate in everything my siblings were able to do. They were all in the band. I wasn't able to do band because my breathing wasn't good enough. I wasn't able to go to slumber parties and things with my friends because my parents were too worried I would get sick or I had an appointment or an infusion or anything I needed to do. When I was growing up, the biggest health challenges were constant skin infections. I was in the hospital all the time for infections, abscesses, anything like that. I had pneumonia once a year, so the breathing difficulties, the lung issues, all of those kind of things. My doctor locally knew something was wrong, and that's when he sent me for genetic testing. So once I received my diagnosis, I was feeling overwhelmed, but also happy that they finally figured out what was wrong with me. The fact that I don't have to find a specialist for every issue that I have. The fact that I don't have to see a doctor for every minor thing. So I have less doctor visits and less amount of pills I have to take every day. I was first introduced to Joenja after I was genetic tested. Being treated with Joenja has been literally life-changing. It's also changed just for the simple fact that whenever I do get ready to have a child, I don't have a constant fear of what if they're born with this condition. I know that there's medicine now to help improve that condition and that there's always something to help them.
Joenja, Leniolisib, is a prescription medicine that is used to treat activated phosphoinositide 3-kinase delta, PI3K delta syndrome, APDS, in adults and children 12 years of age and older. Important safety information. Tell your healthcare provider if you are pregnant or plan to become pregnant. Joenja may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start receiving Joenja. Use effective birth control to prevent pregnancy while taking Joenja and for 1 week after you stop taking Joenja. If you plan to become pregnant, continue taking your birth control for 1 week after stopping Joenja. Talk to your doctor about what type of birth control method is right for you while taking Joenja. It is not known if Joenja passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take Joenja. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Joenja and certain other medicines may affect each other. Tell your healthcare provider if you are scheduled to receive an immunization, vaccine. Joenja may affect how well a vaccine works. Know the medicines you take. Keep a list of your medicines and show it to your healthcare provider and pharmacist when you get a new medicine. The most common side effects of Joenja include headache, inflammation of sinuses, and dry, itchy, and inflamed skin, eczema. These are not all the possible side effects of Joenja. Tell your healthcare provider about any side effect that bothers you or does not go away. You can also report negative side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Pharming Medical Affairs at 800-930-5221. For more information, go to joenja.com. For the full prescribing information, go to joenja.com/prescribing-information.pdf.